Good afternoon and welcome to today's press conference. I'm Mia Rabson from the Canadian Press and I will be moderating today. We have with us Health Minister Jean-Yves Duclos, the Chief Public Health Officer of Canada, Dr. Theresa Tam, the Deputy Chief Public Health Officer of Canada, Dr. Howard New. This is not a COVID briefing, just to be clear. And I believe you have some opening statements and then we'll go for questions. We'll start with questions in the room and then we'll move online. So go ahead, Minister.
Merci et bonjour à tous et à toutes. Merci de me permettre de m'adresser à vous aujourd'hui avec mes collègues, la Dr. Tam et le Dr. Liu. Il y a aussi Matthew Jones qui est présent pour répondre à certaines des questions plus techniques. Ce matin ou cet après-midi, nous aimerions faire une mise à jour sur les conséquences des feux de forêt sur la santé des Canadiens et des Canadiennes. L'état de santé de notre population est intimement relié à l'état de santé de notre environnement. Cette année, les Canadiennes et les Canadiens ont été confrontés à des répercussions sans précédent des feux de forêt. Et le plus préoccupant, c'est que le pic de la saison des feux de forêt ne sera probablement atteint que dans plusieurs semaines. Ces événements ont déjà une incidence réelle sur notre santé physique et mentale. Présentement, un total de 423 feux de forêt sont actifs en Colombie-Britannique, au Nunavut, en Alberta, en Ontario, au Québec et en Nouvelle-Écosse, dont la moitié sont hors de contrôle. Depuis le début de l'année, nous estimons que près de 6 millions d'hectares ont déjà brûlé au pays et nous ne sommes qu'en juin. Cela est 18 fois plus que la moyenne sur 10 ans à cette date. Nos pensées sont évidemment avec toutes les personnes et toutes les familles qui ont été déplacées. Plus de 100 000 personnes ont dû quitter leur maison cette année en raison des feux de forêt et plusieurs personnes attendent toujours de rentrer chez elles, y compris des membres des Premières Nations. People across the country are feeling the effects of these wildfires. Smoke from wildfires contains harmful pollutants and even low levels can impact our health. People in Western Canada and in some Indigenous communities have known this all too well for many years. Others may be experiencing it for the first time. It is therefore important that we all understand how to protect ourselves in the next few weeks. One helpful tool is to use the Air Quality Health Index, or AQHI. The Air Quality Health Index is continually updated and reports air quality in many locations on a scale of 1 to 10 plus, a rating of 10 plus like we had in Ottawa 2 weeks ago being considered very high risk. If the AQHI is high, or if you see and smell smoke in your area, you should consider staying indoors and avoiding strenuous outdoor activities, keep doors and windows closed, consider installing a HEPA filter system or use a portable air purifier to improve indoor air quality. We should be particularly mindful of young children, expectant mothers, seniors, and people with heart and lung conditions. These are some of the groups at greatest risk for serious health effects from poor air quality. Many communities in affected areas have opened clean air shelters in public facilities to ensure that everyone has access to clean, cool air. If we must go outdoors when the AQHI is high, we should limit the time and consider wearing a mask to help filter harmful particles. The Government of Canada will also continue to collaborate with provinces and territories to ensure they have the resources they need to address this crisis. So far, we have responded to requests for federal assistance from the provinces of Alberta, Nova Scotia, and Quebec. For example, the Public Health Agency of Canada has supplied Alberta with essential items like cots, blankets, ward boxes, and disposable sheets. PHAC is also working with provinces and territories, as well as community organizations such as the Northwest Company, to make N95 masks available to vulnerable populations. We continue to offer support to community organizations with national reach, such as the Canadian Interagency Forest Fire Centre, to ensure that masks are available to those who need them most. Where we can, we will pre-position supplies in anticipation of future needs. To help boost air quality monitoring capacity during the emergency response, Health Canada is also providing air quality monitors. Thus far, we have sent 6 air quality monitors to Nova Scotia and 24 to Quebec. We have also provided 2 monitors to the Yukon, with additional sensors to follow later this month. These will be used by long-term care facilities and hospitals to protect patients and test both indoor and outdoor air quality. Finally, following a request from the British Columbia First Nations Health Authority, Health Canada is procuring an additional 25 indoor air quality monitors, which will be deployed in the next few weeks. Permettez-moi en terminant de remercier les membres des
To conclude, I would like to thank members of the Canadian Armed Forces who are working hard to stabilize the situation and providing assistance in Alberta, Nova Scotia, and Quebec. We are also very grateful to the firefighters working day and night to protect our communities, without forgetting volunteers and all those working on the ground to help people and communities that are affected. If you or anyone you know needs help during these difficult times, please visit the website Better Health Canada that offers free and confidential mental health and drug addiction resources. These services are provided 24/7 every day. I will now give the floor to Dr. Tam and Dr. No. Thank you.
Bonjour à toutes et à tous.
Good afternoon, everyone.
Seeing more intense and frequent weather events associated with climate change. Many regions and communities across the country are witnessing this firsthand as wildfires continue to burn across the country. As observed over the last few weeks, wildfire smoke can impact air quality over vast distances, affecting the respiratory health of people who live hundreds or even thousands of kilometers away. Wildfire smoke is made up of small particles and gases. It is the fine particles not visible to the human eye that carries the greatest risk to human health, as it can be inhaled deep into the lungs and cause inflammation and irritation. Some of the other components of smoke can also irritate the eyes, nose, throat, and lungs. There is growing evidence that exposure to seasonal wildfire smoke may have longer-lasting impacts on our health. Indigenous communities in northern and remote regions are disproportionately affected by emergency events, including floods and wildfires. This year, many First Nations have been forced to evacuate from their homes and ancestral lands due to wildland fire activity. No matter where you live in Canada, you can be affected by wildfire smoke. In addition, wildfires often occur during extreme summer heat. Each of these events can pose a significant threat to our health, especially when combined. To reduce the risk to our health, we must take steps to be prepared and be proactive. By using a multi-layered approach, including evaluating your health, you can reduce your risk. Be prepared includes being ready to take care of yourself and your family, including pets, should you be affected by wildfires or smoke. For example, ensure you have a sufficient supply of necessary medications and maintain your home ventilation system and use a clean, good quality air filter and find out where your local clean air center is. Use the WeatherCan app, listen for local air quality statements. Check the information from local health authorities to stay informed about air quality, including the Air Quality Health Index, or AQHI, in your area or an area where you may be traveling. If the air quality is poor, or if you see or smell smoke, you can reduce smoke exposure by staying inside with doors and windows closed, but keep cool. Being too hot poses more risk than breathing smoke for most people. If you do not have air conditioning and it is too warm to stay inside with the windows closed, seek out a local cooling or clean airspace. Consider minimizing your exposure by limiting outdoor activities if the air quality is poor, especially if you're at higher risk of smoke-related health impacts. Consider rescheduling these activities during better weather conditions. If you must spend time outside, consider using a well-fitted respirator-type mask to reduce exposure to the fine particles from wildfire smoke. No one is immune from the health impacts of wildfire smoke and extreme heat, but some people and communities are at greater risk for severe outcomes and should take extra precautions. These include seniors, pregnant individuals, infants and young children, people with asthma and other pre-existing chronic health conditions, outdoor workers, and those engaged in strenuous outdoor activities, including firefighters and emergency responders. Watch for the more common symptoms of smoke exposure, which include irritation of the throat, nose, and eyes, cough, wheezing, and headaches. If you have any of these symptoms, seek clean air either within your home or in a public space. If it is also hot, then watch for the symptoms of heat illness, which includes headaches, muscle cramps, thirst, dark urine, nausea or vomiting, or even sleepiness. Make sure to stay cool and well hydrated. If you need to make a choice, then staying cool is more important than having clean air because heat illness is more serious. Seek immediate medical attention if you develop severe symptoms, such as difficulties breathing, chest pains, high body temperature, hot, red, and dry skin, dizziness, or confusion. And remember to look out for each other. Take the time to check on neighbors, friends, and older family members. By staying informed and being prepared, we will get through this fire season together safely. Thank you. Merci. Miigwech.
Bonjour à toutes et à tous.
Good afternoon, everyone. Canada is experiencing more intense and frequent weather events associated with climate change. Many regions and communities across the country are witnessing this firsthand as wildfires continue to rage. As observed over the last few weeks, wildfire smoke can reduce air quality over vast distances, affecting the respiratory health of people who live hundreds or even thousands of kilometers away. Wildfire smoke is made up of small particles and gases. It is the fine particles, not visible to the human eye, that carries the greatest risk to human health, as it can be inhaled deep into the lungs and cause inflammation and irritation. Some of the other components of smoke can also irritate the eyes, nose, throat, and lungs. There is growing evidence that exposure to seasonal wildfire smoke may have long-lasting impacts on our health. Indigenous communities in northern and remote regions are disproportionately affected by emergency events, including floods and wildfires. Many First Nations have been forced to evacuate from their homes and ancestral lands due to wildland fire activity this year. No matter where you live in Canada, you can be affected by wildfire smoke. In addition, wildfires often occur during extreme summer heat. Each of these events can pose a significant threat to our health, particularly when combined. To reduce the risk to our health, we must take necessary steps to be prepared and be proactive. You can reduce your risks by using a multi-layered approach, including evaluating your health. Being prepared includes being ready to take care of yourself and your family, including pets, should you be affected by wildfires or smoke. For example, ensure you have a sufficient supply of necessary medications and maintain your home ventilation system, and use a clean, good quality air filter and find out where your local clean air center is. Check proactively information about the air quality for special quality statements and the Air Quality Health Index to stay informed about air quality in your area or an area where you may be traveling. If the air quality is poor, or if you see or smell smoke, you can reduce smoke exposure by staying inside with doors and windows closed. But keep cool. Seeing heat also poses more risks than breathing smoke for most people. If you do not have air conditioning and it is too warm to stay inside with the windows closed, seek out a local cooling or clean air space. Consider minimizing your exposure by limiting outdoor activities if the air quality is poor, especially if you are at higher risk for smoke-related health impacts. Consider rescheduling those activities during better weather conditions. If you must spend time outside, consider using a well-fitted respirator-type mask to reduce exposure to the fine particles from wildfire smoke. No one is immune from the health impacts of wildfire smoke and extreme heat, but some people and communities are at greater risk for severe outcomes and should take extra precautions. These include seniors, pregnant individuals, infants and young children, people with asthma and other pre-existing chronic health conditions, outdoor workers, and those engaged in strenuous outdoor activities like firefighters and emergency responders. Watch for more common symptoms of smoke exposure, which include irritation of the throat, nose, and eyes, cough, wheezing, and headaches. If you have any of these symptoms, seek clean air either within your home or in a public space. If it is also hot, then watch for the symptoms of health illness, which include headache, muscle cramps, thirst, dark urine, nausea, vomiting, or even sleepiness. Make sure to stay cool and well hydrated. If you need to make a choice, then staying cool is more important than having clean air because heat illness is more serious. Seek immediate medical attention if you develop severe symptoms such as difficulty breathing, chest pains, high body temperature, hot, red, and dry skin, dizziness, or confusion. Finally, remember to look out for others and offer them assistance. Take the time to check on neighbors, friends, and older family members. By staying informed and being prepared, we will get through this fire season together safely. Thank you.
Thank you. We'll start with questions in the room. We'll have one question, one follow, and then we will move online. If you are on Zoom and you would like to ask a question, please use the raise hand function, and we'll start with Kevin Gallagher from CTV News.
So this question is certainly for Minister Duclos, but Dr. Tam and Dr. New, it might also be pertinent for you as well. During these times of very acute and poor air quality that's being caused by these wildfires, there's also often a correlation in an increase in hospital admissions, increase in people going to the emergency room. I mean, this is all coinciding with the Canadian Medical Association Journal putting out an article today saying that emergency rooms are in crisis, staffing shortages, that this is something that would be prolonged and for quite some time. So is there a concern that already squeezed emergency rooms will be in even worse shape given the outlook for wildfire smoke affecting people's health across the country?
Well, thank you for the question, and I'll turn to Dr. Tam in a moment. That is correct. Now, our emergency departments are already quite burdened. We know the lasting impact of COVID-19 on healthcare workers in particular, which has led many of them to leave or to retire early. So the situation is obviously continuing. Although there are signs of improvements in some parts of Canada, overall, it is still an issue of great concern both to workers and to patients. Now, when it comes to what Health Canada and PIAC in particular have been able to see given the recent occurrence of the wildfires, I'll turn to Dr. Tam.
Yes, I'll speak more generally to the impact of wildfire smoke. So wildfire smoke consists of a collection of different gases and particles. So in our remarks, we talked about these fine particles, or sometimes you see the designation PM 2.5. These are small, tiny things that you can potentially then inhale into your lungs and cause irritation and inflammation. And there's certainly correlation between these fine particle inhalation and lung problems and airway problems such as asthma, chronic obstructive airways disease exacerbations, bronchitis and pneumonia, so infections as well. Although the data is still somewhat mixed, there could also be impact on your cardiovascular system. And so that needs to be further studied. What is even more interesting is if these wildfires become more frequent and of longer duration and repeated every year, for instance, you have to sort of look at the longer term impacts over multiple exposures. And that we know less about. Although there have been studies in certain populations, such as firefighters who are more exposed to wildfire smoke, that would suggest that there could be longer-term impacts. I think those need to be studied. Of course, any impact, such as asthma going up, will have some impact on emergency rooms and the healthcare system.
Dr. Yu, maybe the only additional thing I would add is that certainly, we have seen from past experience that there will be an impact, let's say, for example, visits to emergency departments. But I think the average individual can certainly take steps to prepare and hopefully maybe avoid having to see a doctor or go to the emergency department. For example, if you're prone to asthma, it's a good idea to be have a good supply of, let's say, your inhalers, your ventilators, make sure that they're up to date, on expired, and so on. And so also to take a look at what activities might have planned if obviously the air condition, the air quality is not looking good for a certain day, then maybe you might look at foregoing some of the outdoor activities you might normally do. But that depends on your own evaluation of your health. So I think there's a lot that the average person can also do to look at their own situation, see also what they could be doing for their family and friends, and then hopefully in that way prevent any visits to the emergency department.
My follow-up will just be for you, Minister. What can be done about the shortage of doctors that's affecting the capacity of emergency rooms? And certainly if doctors are saying that this is a crisis and it's now for the foreseeable future, is what strategies can be used to perhaps give more money or make sure provinces spend dedicated money on training, new staff to meet these long-term and short-term capacity issues?
Great question, and I'll answer in three different pieces. The first one dates back to February the 7th, when we had the Prime Minister making an offer to provinces and territories of the order of an additional $200 billion over the next 10 years. The second thing is that out of the shared areas of priority that we were able to agree on, a key one was about health workers. And we all agreed to the importance of retaining them, which is absolutely key to everything we do around supporting the health workforce. So retaining them means providing the mental and physical support that they need to pursue their career and staying in their career. Also, obviously, training more because our population of health workers is aging rapidly, as a population overall is aging rapidly. And finally, recognizing more quickly and more efficiently the credentials of those that have been trained in other places in Canada or outside of Canada. On these three different pieces, the retention, the recruitment, and the recognition of the credentials of the health workers, we're making good progress. I will just point to the fact that just a week ago, Nova Scotia and PEI followed earlier, predated earlier by other provinces like Ontario and British Columbia, have been doing great things, in particular on retention, recruitment, but also on the recognition of foreign credentials. Now in Nova Scotia, if you are a nurse being trained outside of Canada, it's almost immediate that your credentials will be recognized. And this is also happening in other parts of the country for physicians and other health workers. In Atlantic Canada, we are now seeing an Atlantic registry of physicians, which facilitates the movements of physicians from one province to another in areas, in times when there are crises and people, health workers, need to be moving from one place to another. So it's obviously something critical. It's also clearly a significant challenge in a federation where the federal government doesn't have the jurisdiction or the power to make those changes. But it's a great source of progress and hope to see provinces and territories moving in those directions.
Thank you. We'll go to Louis Blouin from Radio-Canada.
Vous avez dit, Monsieur Duclos, que
Mr. Duclos, you said that the peak of the fire season has not yet been reached. Could you give us an idea of what is going to be this most severe period, just for us to understand the curve in the coming weeks? Answer: thank you. Environment Canada is telling us that the peak of the season is generally in July and the beginning of August, when there's a combination of two things, a dry season and a hot season. This is usually between the end of July and the beginning of August. And over the past few weeks, we dealt with wildfires that are not yet under control. We know that such intense fires will continue in the coming weeks and will continue to cause more fires. Traditionally, wildfires are usually more intense and more problematic on the environment and on the health of citizens. Question: you have said that if there's smoke, we need to find an area with clean air. It's not everyone who has a purification system at home or a ventilation system at home. So what is your recommendation? Should people leave their homes, change cities? Let's not forget that there are some people who are very vulnerable when it comes to health. What should be done when it comes to the effects? Answer: you have to pay attention to the quality of air every day, but it's also important to stay in a cool area. If you have to stay outside, it's hot. And maybe if you don't have a good air conditioning system, it's better to find a cool place because heat is more serious. It is very important to be aware of the special statements that are released in various localities. I'm sure that there are some units with purified air, and local authorities are able to send people to some places because they know that there are many people who are not able to remain in their homes. So it's very important to stay informed, and it's also important to educate the general public. It's good for people to know what the air quality index is. You need to check the weather. Is it going to rain? And adjust your activities.
Hey there. I was just wondering if you have any statistics on how many people are getting sick, where those people are, how sick are they getting? I hear you on the long-term effects, but what is the situation on the ground now?
I'll start with high-level numbers, which have been computed by Health Canada over the last decade. So between 2013 and 2018, it's estimated that bad air quality has caused the premature deaths of about 15,000 people, amounting to 6% of GDP, which is obviously considerable. Out of these deaths and impact on the economy, about a sixth is due to wildfires. So translating these numbers, it would be during an average year between 2013 and 2018, it would be about 2,500 people who would have died of the long-term consequences of bad air quality because of wildfires, and that's an economic cost of about 1% of GDP, which is $20 billion. So these are average numbers dating a few years back. Now we know that because Canada is warming at twice the rate of the rest of the world, because of what we're seeing this year, which is that to date there have been 18 times more forests being burnt than what we have seen over the recent years. So we expect, unfortunately, both the short-term and the longer-term consequences of bad air quality due to wildfires to be even larger than the numbers I just gave you. Now, on what we already know until now, based on the current season, I would turn to Dr. Tam.
Yes, so there's no real-time reporting from local jurisdictions up to, say, the Public Health Agency or Health Canada on the day-to-day. It's not like COVID, we got a system going and, everyone is tracking numbers every day. That isn't the case necessarily with asthma or COPD. But I think it is important, certainly at the local level, to observe the trends. I think Minister Duclos be a big supporter of, making sure we get data in more real time in the health system. And that might help in the future, but no, we don't track. It's not like a reportable disease that we track in real time.
Thank you. And just as a follow-up, Minister, you mentioned that the government has already procured more air quality monitors, but you also mentioned that the peak is yet to come. So I'm wondering if there are any thoughts in terms of preemptive procurement to deal with what might be coming.
Indeed, Health Canada and PHAC are pre-positioning some of those materials. As you mentioned, we have been sending air quality monitors. We've been sending masks and other pieces of equipment that people can use either in their homes or in long-term care and hospital settings. And we are doing this, as you said, preemptively, in advance of the season that we know almost for sure will be quite difficult for many communities in Canada. And as we do that, and as Dr. Tam also mentioned, we are obviously working with closely and listening to carefully the health workers and the leaders, the health leaders that we are hoping to continue supporting in the next few weeks.
Thank you. I'm going to take the moderator's privilege to ask a couple questions from this chair. Dr. Tam, you mentioned that it's not a reportable disease like COVID was or other public health. Should it be? Should air quality or respiratory problems or other issues connected to air quality, should that become a reportable issue so that we can track it better?
Well, I think if we move the health system data to a modern era where there's no increase in burden, but it's in an efficient way, be able to track all sorts of health indicators over time, that could be helpful. Certainly, I think much of this data may be made available at the local level. So at the national level, in past years, there hasn't been as much attention because a lot of the wildfires were in the West. So I heard from my colleagues, the chief medical officers from, say, the Atlantic or Nova Scotia, hasn't had as much experience. And so I think in preparation for what might be coming in the future, looking at systems and their ability to report trends, whether it's emergency rooms, others, could indeed be quite helpful. But that's not the reality right now.
And sort of further to that, has the national emergency stockpile been adjusted, or should it be adjusted to account for the changing needs from climate-related things like wildfires?
I think the National Emergency Strategic Stockpile, and particularly coming out of the pandemic, should have its scope and mandate confirmed. And I think part of that will include an assessment or on forecasting of the types of health risks that could hit the Canadian population. But for sure, we have quite an extensive social service supply, cots, blankets, and other supportive equipment. And we, of course, have quite a lot of masks actually stockpiled. And these, we've now learned to be able to use them in a more flexible way. So I think right now we expect the supplies to be okay on the mask front, but we will have to take into account, well, if it's not just viruses, if there's other health risks that may benefit, then what will be appropriate. But of course, much of the mask used in the population is by the province and territory. So we do have to sort of coordinate with them. We are focused on the populations impacted most and suffering from systemic inequities. So which is why the minister has commented on the fact that the agency is working with certain community organizations and other distribution points that we established during the pandemic to further distribute masks to those who are most in need and may not be able to afford to get them.
I'll give one more call out to questions on the line on Zoom. If you have a question, please use the raise hand function now. And seeing none, that will conclude today's press conference. Thank you.